This is NG tube insertion. So the first thing I'm going to do is I'm going to confirm the order. So Cam Casey has an order to insert an NG tube and connect it to the low continuous suction. So once the x-ray comes back and the radiologist confirms that the tube is in the stomach, I will connect it into the low continuous suction. So now I'm going to gather my supplies. I have all my supplies right here. And now I'm going to introduce myself to the client. Knock, knock. Hello, I'm Amanda. I'm going to be your student nurse for today. I'm going to perform my hand hygiene. Can you please tell me your name and date of birth? Cam Casey 12919XX. Okay. Are you allergic to anything like latex or adhesives? No? Okay. I'm going to provide my privacy. Okay, Mr. Casey. So your doctor has ordered for an NG tube to be put in. It's for your gastric decompression because you have a bowel obstruction. An NG tube is a nasogastric tube. It's going to go in through your nose, down your throat, and into your stomach. And we're just going to hook it up to suction, and we'll decompress your stomach. This procedure is not supposed to hurt, but if it does, raise your left hand and I will stop. Do you have any questions? No? Okay. So I'm going to do a respiratory and a GI assessment on you. I'm going to raise the head of your bed and get you in an easily accessible position. How would you say your pain is? Okay, you have a 7 out of 10 abdominal pain. Okay. So I'm going to assess your lungs first. I'm going to listen to your anterior and your posterior lung sounds. I'm going to take this from you. Okay. When I tell you to breathe in, just breathe in normally. Breathe in. Breathe in. Is it okay if my stethoscope touches your skin? Yeah, okay. Breathe in. Breathe in. Now I'm going to listen to your posterior lung sounds. I'm going to give you a boost. 1, 2, 3. Okay. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Okay. So your lung sounds were cleared bilaterally with equal chest rise and fall and symmetrical ventilations. So now I'm going to do my GI assessment. So I'm going to inspect, auscultate, and palpate. So upon inspection, I do see that his abdomen is distended, and now I'm going to auscultate in each of the 4 quadrants for 1 minute, unless if I need to listen more, which indicates absent vowel sounds. Okay. And begin. So I don't hear any bowel sounds, so I'm going to listen to this left lower quadrant for 2 extra minutes. Okay. After listening in the left lower quadrant for 3 to 5 minutes, there were absent bowel sounds, and on the other quadrants there were hypoactive vowel sounds. So now I'm going to palpate gently. Okay. So his abdomen was soft, so my GI assessment is complete. Okay. I'm going to replace the gown. Now I'm going to assess his airflow and his skin integrity and his nares. So I'm going to first do my skin integrity assessment. So I see that his nares are clean, dry, and intact, and I see a little mucus obstruction in his left nare and no obstruction in his right nare. Now I'm going to assess the airflow. Breathe in. Breathe in. Okay. So his right nare was more patent, so I'm going to insert the NG tube in his right nare. I'm going to sanitize my hands. My pen right away. I'm going to place this towel on you. At any time, if you feel pain during this procedure, raise your left hand and I will stop. I will also stop if he's excessively gagging, coughing, if he becomes cyanotic, if he can't talk or hum, and I will just stop if he does those things. Okay, now I'm going to do my hand hygiene and apply some clean gloves. Okay. Going to get my equipment ready. I would use a skin barrier wipe on his nose before I put the tape on, but we don't have that, so I will just verbalize that. I would use an adhesive fixation device, but we don't have that, so I'll be using tape. Okay. So now I am going to get my supplies ready. I'll open up my NG tube. Away. On my anti-reflux valve. Now I'm going to measure it. So I'm measuring it from the tip of the tip of the nose to the end of the ear, and then down towards the xiphoid process. So I see it's at 52. So now I'm going to mark it at the 52 centimeter mark with my permanent marker. Okay. So I'm going to give you some water. Okay. So when I initially insert the tube, his head is going to be in a neutral position, and then once the tube advances, I will have him lean his head forward, bring his head to his knees, and sip from the straw. Sip the water from the straw. Okay, now I'm going to lubricate my tubing. Are you ready? Okay, so your head is in a neutral position. Okay, 1, 2, 3. I'm ensuring that the tubing is not kinked. Okay, so it's at the 52 mark. So now I'm going to secure it with tape. This is when I would use my skin barrier and like swab. Okay. He did not become cyanotic or he did not excessively gag, so I advanced the tubing further. Yeah, I'd reassure him if he had the excessive gagging and I would stop. Okay, now I'm going to mark it at the nose area. Now I'm going to pin it to his gown. I'm going to use a safety pin. Okay, now I'm going to check the pH. I'm going to aspirate the stomach contents. I will also call and confirm an x-ray appointment for him to ensure that the NG tube is into his stomach. Okay, I'm now going to test the pH. Okay, so I'm going to dispose of that, and my pH looks at around a 4. So the pH is in, so his pH is a 4, so that's an indication that we are in the stomach. I'm going to throw that away. I'm going to take off my gloves, sanitize my hands. Okay, this is when I will call to get an x-ray appointment. Okay, now I'm going to apply some clean gloves and do some oral care. Would you like oral care to be done? Yes? Okay. trash where you like your water? No? Okay. I'm gonna move this dirty linen. This is gonna go in the dirty linen basket. Okay. I'm going to dispose of my equipment. Take off my gloves for warm hand hygiene. If you pull out your tube or if your tube is causing you some discomfort, press your call light and let me know. I'm now going to make sure my patient is in a safe position. The bed is in the lowest position. I'm going to put this pillow behind his head. His personal items are within reach. His call light is right there by his hand. I'm going to check the brakes of the bed. So that one is on. That one is on as well. Okay, I'm going to check the other side. This one is on. And I'm going to put my foot on that one. And that is on. Okay. Do you need anything else? No? Okay. I'm now going to document the insertion and my skills complete.